What are the downsides of this newer procedure, if any?
There really are many downsides of the procedure. I would say that when you do FUE, because you're sampling a greater area from the donor area on the back of the head, initially on the day of surgery, you need to trim the hair more for an FUE procedure than you would for an FUT procedure. And so after an FUE procedure, for about a week, it is a little more obvious that the patient has had surgery done on the back of their head. But after 1 week, the hair grows back, and literally you cannot see any visible scarring. The other disadvantage, if you will, is that it is a little more expensive to have FUE performed. The difference in cost is about 40–50%. And if you consider this a disadvantage, any FUE procedure, whether it's done with a powered system or with an artist's robotic system, it takes more time to do the procedure. And that is because that when the grafts are being made by the artist's robotic system, the physician, myself, cannot be making the recipient sites at the same time, whereas when we're doing the follicular unit transplant procedure, we could be making the grafts at the same time that I'm putting the little sites in to place the grafts. So a procedure that is necessarily large, for instance, somebody who needs 2,500, 3,000, 3,500 grafts, we have to divide an FUE procedure of that nature into a 2-day procedure rather than a 1-day procedure if we did it by follicular unit transplantation.